Have you ever wondered why your testosterone labs came back normal, but you still feel like something's off? Are you struggling with going to the bathroom often? And have you ever wondered about squirting? Today on our Ask Me Anything episode, we're going to answer all those questions and more for our members. To anyone watching or listening, you will hear or watch half of the episode of the Ask Me Anything here for free. If you want to get the full episode, check out our membership at renamalik.supercast.com, where you get full access to the AMA episodes, as well as early transcripts and early releases of all our podcast episodes. All right, let's get to it.
Had my testosterone checked for the first time, as I tend to avoid going to the hospital. My lab report says my testosterone is borderline low, but my doctor says that it's actually normal if you look at all the other numbers. Can you help me better understand this? This is from initials FS. He's 48-year-old male.
Well, thank you for asking. I think this is a very common question. And testosterone is a little bit complicated because if you look at the normal range on your lab report, it can be anywhere from 300 to 1,000, right? So there's a huge variation in testosterone values. So what is normal for you? Well, that depends. So there's a few factors that go into it. One is that you have another protein in your blood called sex hormone binding globulin, or SHBG. And that is like a car that carries testosterone, but it sticks testosterone to it very, very tightly. So that basically your blood and all the end organs that need testosterone, like your muscle, your brain, your heart, all those different areas can't see that testosterone because it's stuck to SHBG. And so when you have a higher SHBG, that means that your free testosterone that's available to your blood is lower. And so very often you will get both of those blood works checked, as well as maybe a free testosterone, which you can either get tested in the lab or get a calculated value of your free testosterone. Why does that matter? Well, because what your body is seeing is that free testosterone. That is what's actually exerting the action on your body. So the symptoms that you get when you have low testosterone are things like erectile dysfunction, low desire. You're having maybe some brain fog or some cognitive dysfunction. You're having some loss of muscle mass. You're gaining fat mass. You may even see your mood is declining. So you're having some depressive mood or feeling more down lately. And these are all symptoms of low testosterone. And when it gets really bad, you can get symptoms like hot flashes or even infertility. You know, some of these symptoms are quite vague and have multiple different reasons for them. Symptoms like fatigue and brain fog can be due to a number of different things, but that doesn't mean that testosterone isn't playing a role. To get back to what your answer is, why does your testosterone look borderline normal, and is that normal for you? One is, I can't really tell you because I don't know exactly how many testosterone receptors you have, and receptors are where testosterone attaches to, right? So testosterone is seen in the blood, and the cells have these receptors where testosterone attaches to, which then sends signals to the DNA of the cell to make proteins or make appropriate responses to that testosterone. Everyone has a different sort of number of receptors, and also their sensitivity is different. And so when you look at receptors, they have these things at the end called CAG repeats, and depending on the variation in those, your testosterone receptor can be more sensitive or less sensitive. But as a doctor, I don't see that. There's no lab test that I can do that's commercially available right now where I can check how sensitive your receptors are. And so a good way for me to do that, to estimate what you need for testosterone optimization, is to see what your testosterone was when you were feeling well. This is still a little bit complicated because testosterone, the blood work, is extremely variable. So when I check your testosterone today and I check it a week from today, it can vary anywhere from 18% to 50%. We have to sort of check two numbers to make sure we're getting a sense of where your average is. And that gives me an idea of where your testosterone is when you're feeling great. Now, as you age, testosterone declines about 7% per decade. And so what that means is that everyone after the age of about 35, 40 will start seeing a decline in testosterone, but not everyone will get low enough where they have symptoms. And we do have data telling us how low does your testosterone need to be where we start seeing symptoms. So first, you're going to see a loss of nighttime erections. So you're not going to wake up with morning erections or morning wood anymore. Then you're going to see a loss of desire, and then you're going to see a loss of erections. And usually that starts around 250 nanograms per deciliter. But when you talk to the experts of testosterone, most people believe that if you're above 450, your testosterone receptors are probably very well saturated. That doesn't necessarily take into account if you have a high SHBG. Then when we're looking at free testosterone, the studies will say, depending on the units you use, it either needs to be higher than 7.5 or 75 to be considered low. And we start seeing symptoms around 10 or 100, depending on the units you use. So I think these are sort of very specific things that you need to look at when you're getting your testosterone checked to see, hey, are you in a range that's considered normal for you? And where are most people going to start seeing symptoms? And the reason this is important is because taking testosterone as a supplement is not without risk. At some point, when those receptors are all saturated, giving you more testosterone isn't going to give you harder erections, give you more desire, improve your brain health anymore. You may continue to see an increase in muscle growth because those signals will continue to augment even if you're taking more testosterone, which is why we see some people abuse testosterone or anabolic steroids to get larger muscles. But these do not come without risks, and sometimes these risks can be very serious. And I've talked about this before on my video about testosterone is amazing, or is it? So you can watch that to learn more.
So you got to do kind of a calculation. It's not just the total and the free testosterone.
That's very individualized.
Yeah.
So I think you really have to sort of know what's normal for you and follow it over time.
Got it. Next question. My boyfriend had an ex that used to squirt. I have never been able to do it, but he tries so hard to make me squirt. Unless he wants me to pee on him, I have no clue how my body can do this. He seems to think all women have this ability, but I am not built like that. Plus, I am not about to soak my sheets for him. What are your thoughts?
So I'm so glad you asked this question because I think there is a big misconception, especially with sort of the availability of erotic materials, videographic materials. People are starting to see a lot of females squirting and thinking that this is completely normal for every female to do. The reality is when you look at the data, about 40% of women do describe themselves as being squirters. And so the majority, 60%, don't. Now, what is squirting? People love to talk about this. Is it pee? Isn't it pee? So there have been some studies that have tried to figure out like where this is coming from. Is it from the bladder? Is it from somewhere else? And what we've basically come to the conclusion is that the fluid does come from the bladder, and it comes also with some fluid from the Skene's glands, which are specific glands underneath the urethra at the top of the vagina that releases fluid that's analogous or similar to the male prostate. And the way we know that is the fluid that comes from there has something called PSA, or prostate-specific antigen. And so they've tested the fluid and found that there is PSA in it. So the fluid, when you look at studies that have actually tried to look at the chemical composition, it's chemically similar but distinctly different from urine. So it is like very dilute in terms of what's involved. Now, can you learn how to squirt? In theory, perhaps. I don't know if everyone can learn how to squirt, but in theory, if you stimulate where the Skene's glands are, which is essentially where people describe the G spot, there is a possibility that that would then elicit some more fluid from the Skene's gland, which would allow you to squirt. Bottom line is you shouldn't worry if you do or don't. It doesn't mean that you're more aroused or not. When you actually look at qualitative interviews of women who describe themselves as squirters, not everyone likes the experience. Now, some, of course, feel like it's a superpower. They feel like it's great, but there's others who feel embarrassed or just find it inconvenient, as you mentioned, like your sheets get messy. And some people who just really don't care for it one way or the other. And so the reality is it's not something that makes your sexual experience better. It just is something that is visual that people can see. And so bottom line, if you don't squirt, it doesn't matter. What matters is that you're having pleasure and your partner is having pleasure and that you are enjoying each other and having a good time.
Yeah, I do wonder how much psychologically, like for a guy who ends up seeing an actual physical result, how much like that affirms like, man, I really got that orgasm and it's not a fake one.
Right. I think that's really a big part of it, right? We as females who are in heterosexual relationships see the end product of arousal, right, with an ejaculation, but men don't have that. However, there is a way you can tell. So when a female partner orgasms, and a man too, but their pelvic floor muscles will contract at a very specific rhythmic contraction of 0.8 seconds. You can't fake that. Even if you tried, you'd have to be like thinking really seriously about like contracting your pelvic floor at that exact rate. It's impossible. And so you can sort of sense if someone has orgasmed by that, in addition to obviously their nonverbal responses and potentially their sounds, but also you can ask your partner, did you enjoy that? Was that good? Did you orgasm? And ideally they'll tell you the truth.
My boss pees a lot. Like he's always going to the bathroom. I thought it was maybe because he was diabetic, because I know that can make you quite thirsty. But he admitted to me and the rest of the guys that he's got prostate problems. and that we will get this someday. Most of us are guys in our office, and we were all trying to think of ways to prevent prostate problems. What advice do you have?
This sounds like this guy, your boss, has benign prostatic hyperplasia, which means that he has a prostate that's enlarged. And when your prostate enlarges, it basically narrows the urethra, or the tube where urine comes through, which means that sometimes it can make you have a weak stream. Sometimes you have to strain to completely empty your bladder. Sometimes your stream starts and stops, and it takes a long time to empty. Sometimes you wake up a lot at night. Now, conversely, you can also have to go very often and very urgently because the bladder is responding to having that blockage there. Sometimes you might even dribble. Either that can be urinary dribble after you pee, or that can be like, gotta go, and you can't make it and urine leaks out. Now, how can you prevent this? This is very, very common, and up to 80% of 80-year-olds get BPH, or an enlarged prostate. So it is very common for prostate enlargement to occur. Now, there are some things that are out of our control, like genetics. So if your father had an enlarged prostate, you are likely to get it, and get it even a little bit younger than he was when he got it. But there are things you can do to protect yourself based on the data. We know certain things are linked with enlarged prostate and certain things are protective. So first and foremost is look at your waist circumference. Having a normal waist circumference, or a smaller waist, actually is protective against an enlarging prostate. And in the same vein, when you have metabolic conditions or metabolic syndrome like high cholesterol, high blood pressure, or diabetes, those are linked with having more incidence of benign prostatic hyperplasia, and especially a disease called diabetes, because diabetes affects the bladder and the prostate in different ways. It affects the bladder because it affects the nervous function of the bladder, just like it affects your hands and your feet. It can also affect the nerves of the bladder. And also, you can sometimes start urinating with more glucose or sugar in your urine, which can make you urinate more frequently or more often. Ideally, avoiding these conditions altogether is helpful, but if you have them, doing the necessary lifestyle changes as well as taking the medication to help control them is very important. Now, next up is exercise. So it doesn't have to be crazy, strenuous exercise. Even walking for 2 hours has been shown to help prevent enlargement of the prostate. So it doesn't need to be super strenuous, although I always encourage patients to do about 150 minutes of moderate intensity aerobic exercise every week, because it helps not only your prostate, but also helps sexual function and heart health. Another thing is to get evaluated for sleep apnea. So obstructive sleep apnea is a condition where your airway doesn't get enough oxygen through it when you're sleeping. And this causes you to wake up more often at night to urinate. And we know that treating obstructive sleep apnea can actually improve how often you wake up at night to pee. Next, you want to look at your diet. Increasing vegetable intake actually has been shown to reduce the risk of BPH, and generally prioritizing a diet that's made of unprocessed foods, whole fruits and vegetables, whole grains, lean meats, and generally a Mediterranean style diet has been shown to be the most beneficial. You can also consider including lycopene in your diet, which means tomatoes, cooked tomatoes, watermelon, those sorts of things have been shown to be beneficial for prostate health if you enjoy them. And there's certain sort of habits you want to avoid. So one is trying to pee just in case. When you pee just in case, you're teaching your brain that your bladder holds less than it actually does. So your brain starts getting signals that your bladder is actually smaller than it is, which means that you end up going to the bathroom more frequently. We also don't want you to strain to urinate. And this is tough because if you have an enlarged prostate, sometimes you find yourself straining, but you're actually then putting more undue tension on your pelvic floor, which are muscles that are very important in urination. So those things are super helpful. If you're already struggling with symptoms, you want to tend to avoid drinking a lot of fluids in the last 2 hours before bed, and take note of any bladder irritants you're eating or consuming. And those are things like caffeine and alcohol. And in some cases, not everybody, spicy foods, artificial sweeteners, tomato-based products, citrusy fruits and juices, all of those things can irritate the bladder, which makes your symptoms significantly worse for some people. Most people are bothered by caffeine and alcohol, and even if you've had a lot of caffeine throughout your life, sometimes you can become more sensitive later in life. If you liked that episode, make sure to check out the full episode, which is only available to our members at renamalik.supercast.com. And as always, remember, take care of yourself because you're worth it.